Pelvic floor health for men is such an important topic, not talked about nearly enough. I'm Courtney Verdon, founder of iCOREmethod. I'm a fitness trainer and pelvic floor expert, and I have been working with men for over 20 years, men of all ages, from professional athletes to the everyday man. I have been helping men restore their pelvic floor, improve their posture, and improve athletic performance. Join me as we unpack a man's pelvic floor, what it is, why it's important, and what you can do for optimal pelvic floor health. We are going to cover all about a man's pelvic floor, what it is, the functions of the pelvic floor, symptoms and risk factors for pelvic floor dysfunction, as well as Kegels and do you need them, and how to improve your pelvic floor health. But let's not forget the importance of breathing in your pelvic floor and diastasis recti in men. We will go over what that is, the causes, symptoms, and exercises you need to avoid, and how to fix diastasis recti if you have it, and how that impacts your pelvic floor health. So what is a man's pelvic floor? It's a network of muscles, fascia, ligaments, and nerves, and it is at the base of our core. The pelvic floor attaches at the front at the pubic bone, the back at the tailbone, and then side to side sits bone to sits bone. This diagram here is what the pelvic floor looks like, and you can see that it has striations left to right, front to back, and circular. So our pelvic floor works in multiple directions. It's made to lengthen and rebound, so contract and relax through different planes of motion in different directions. And at least 16% of men have pelvic floor dysfunction, and that is men reporting it. So that number could potentially be higher, but that is a considerable amount of men who have pelvic floor dysfunction, and many of them are unaware that there's an issue going on, or they are aware there's an issue and they're unaware that it's from their pelvic floor. There are so many functions of the pelvic floor. So our pelvic floor helps with our bladder and bowel functions, ensuring that we maintain good bladder and bowel continence and good function throughout, and is essential for sexual function as well, including erectile function, ejaculation, and your overall sexual satisfaction. It works with your lumbar spine, abdominals, diaphragm, and even our hip muscles to stabilize the hips and trunk. It is the base of your core and very essential for movement and a crucial component of your posture. And it coordinates with our diaphragm when we breathe. What a lot of people don't understand is that our pelvic floor helps coordinate the movement between the upper and lower body and the left and right sides of our body, and really is crucial for sports performance. And it helps maintain optimal intra-abdominal pressure, which we will talk about later when we talk about diastasis recti. There are many symptoms of pelvic floor dysfunction. While you might have several symptoms of dysfunction, you might also have just one or two symptoms of dysfunction. Now, just because you have more symptoms doesn't necessarily mean that your dysfunction is more severe. That would depend on many different factors. Let's go over some most common symptoms that men experience, including bladder symptoms. So bladder leakage is common, pain with urination, or urinary frequency issues, meaning you might be using the restroom more often than usual, or feeling like you're always having to go, or that you're not fully able to empty the bladder when you go, or that when you are going and using the restroom, that you feel like the bladder's full, but there's hardly anything there. You also might have difficulty initiating urination or a really weak urine strain. There's also bowel symptoms. Constipation is surprising to a lot of people that it's a symptom of pelvic floor dysfunction because there are so many people who suffer from constipation. Some people experience fecal incontinence, that's fecal leakage, or pain during bowel movements. Sexual symptoms are fairly common for some men as well. That could include pain before, during, or after ejaculation, erectile dysfunction, or ejaculatory disorders. So there's also quite a few other symptoms of pelvic floor dysfunction that surprise people. Compromised athletic performance, postural misalignments, poor movement patterns can be signs of pelvic floor dysfunction. Your body's interconnected, so everything is working together. And if we've got issues with the pelvic floor, we often have issues elsewhere. You might also be experiencing pelvic or groin pain, penile or testicular pain. You might have pain or pressure in the rectum or the groin. You might have muscle spasms, pressure, pain in the pelvic area. You might have tailbone or lower back pain. That is quite common with pelvic floor dysfunction. And many people see a chiropractor for back pain thinking that's going to work. And often it is really a result of pelvic floor dysfunction and misalignment in the pelvic floor. So while chiropractic work can be incredibly powerful and great for people, if you've got lower back pain, you really should be doing pelvic floor exercises and pelvic floor therapy. You might notice abdominal pressure and increased pressure in the abdominals or a bulging in the perineum. So these are some symptoms that are quite common with men. Again, you might have one and you might have several. But if you have some symptoms of dysfunction, I highly recommend working with the iCOREmethod program and the app to really help resolve these issues and help prevent new issues in the future. Now that we know what the symptoms of dysfunction are, what are risk factors, and are there ones we can control? So while some are out of our control, such as age, we can help control our weight because obesity is a risk factor, chronic constipation, stress is a huge risk factor, which really causes people to often have too much tension in their pelvic floor. Smoking contributes to pelvic floor dysfunction, as do footwear choices. Sandals, footwear that goes in between the toes disrupts our gait and our fascia, which can impact the pelvic floor. Also, pelvic surgery, including prostate surgery, trauma, nerve damage to the pelvic region is a risk factor, and radiation to the pelvis. If someone is chronically sneezing or coughing, that too can cause pelvic floor dysfunction. Same with improper heavy lifting. If you've ever seen some videos of power lifters, so many different power lifters have pelvic floor dysfunction and bladder leakage. Their pelvic floor is not withstanding all of that excessive pressure from that heavy lifting. And then high impact exercises or excessive abdominal exercises can also lead to pelvic floor dysfunction, but also diastasis recti, which we will talk about later. Let's discuss Kegels and the truth behind Kegels. You may have heard of them, may have not. Most people think Kegels are for women. Kegels are a concentric contraction of the pelvic floor. It's the muscles used to stop the flow of urine. That would be the pelvic floor muscles that are doing the Kegels. It's that tightening and relaxing of those muscles. It's not going to realign the pelvic floor. It's one exercise, one plane of motion, and they are appropriate for some who have low tone throughout the pelvic floor. But a problem that a lot of men and women have is that the pelvic floor is already too tight. There's too much tension. So you might have a hypertonic pelvic floor, which is too much tension and tightness throughout the pelvic floor. It might be spasming, or maybe just portions of the pelvic floor are already too tight. If you're doing Kegels and that is the case, it's going to make that tissue tighter and tighter and exacerbate issues you already have or potentially create new issues. I don't love Kegels. I really like exercises that contract and relax the pelvic floor in multiple planes of motion that are going to realign the tissue of the pelvic floor. Those are my preferred methods. If you want to be doing Kegels, I highly recommend you see an internal pelvic floor PT who can help you monitor the tone and tension of your pelvic floor, because even if you have low tone throughout the pelvic floor and Kegels are appropriate, there will be a point in time, most likely, when you have enough tension in the pelvic floor. And if you continue to do Kegels or do them excessively, now you might actually run into the opposite problem and begin to have too much tension in the pelvic floor. So again, I prefer no Kegels. I love the iCOREmethod exercises because it focuses on relaxation of the pelvic floor and building appropriate tone and strength throughout the pelvic floor. And that's really how our pelvic floor is designed to work, with the multiple planes of motion and movement. How do we improve pelvic floor health? Proper pelvic floor training should include both eccentric and concentric contractions and in multiple ranges of motion to train the pelvic floor to have the ability to relax and contract with whatever activity you are doing, whether it is your daily life or you're having sexual intercourse, or you are playing a sport. We want the pelvic floor to be healthy and resilient and to be able to turn on and function how it's supposed to through whatever activity we are doing throughout the day. We also want to reduce and eliminate pelvic floor dysfunction symptoms and restore proper tone and tension in the pelvic floor, and really realigning the pelvic floor and the tissue of the pelvic floor and the fascia is critical for optimal pelvic floor health and improving our posture and our sports performance and improving our gait. So my favorite method is the iCOREmethod. That is what I have used on myself after delivering my babies experiencing pelvic floor dysfunction, and I have used it with countless people privately and through the app as well. People worldwide have been using it to restore proper pelvic floor health, to eliminate dysfunction and help prevent it. We have a full body approach for pelvic floor health. So we're going to restore tone and tension throughout the pelvic floor and the function and alignment of the pelvic floor, but also address issues above and below the pelvic floor to improve your posture, your gait, your performance, and really improve your overall body, because our body is interconnected and everything works together, which is why I prefer a full body approach for pelvic floor therapy. We have fascial health information, also preventative information for the future, daily workout calendar, no matter what your fitness level is. Our breathing greatly impacts our pelvic floor. So it's going to impact the ability of the pelvic floor to relax, contract, and lengthen. Diaphragmatic breathing is wonderful for our pelvic floor health. Up in our app and YouTube, we have all about diaphragmatic breathing, exercises you can do to help improve your breathing. So I'd encourage you to check that out. Now, as we breathe in, our diaphragm lowers and our pelvic floor lengthens and descends slightly in our body, and our abdominals expand. And as we exhale, the diaphragm will lift, which our pelvic floor should naturally contract and lift too, and the abdominals contract gently in. Now, if we are breathing really shallow, this natural movement might not be happening, and the pelvic floor might not be relaxing and expanding as it should. I would encourage everyone to go into the app or check it out on YouTube and watch the diaphragmatic breathing and learn if you are a shallow breather. And if you are, I'd encourage you to practice those exercises. We also have other breathing exercises you can follow along to within the app to really improve your pelvic floor health. Diastasis recti is commonly thought of a women's issue, but men can have diastasis recti too. Pregnancy is the number one risk factor, but there are many other risk factors as well, which we will get into in a moment. So what diastasis recti is separated abdominals by an overstretched linea alba. That is our midline fascia and connective tissue. It can be a separation above, at, or below the belly button, or a combination of, and there's a diagram here you can look and see what that looks like. And the separation is measured in finger widths. In the app, we have an amazing self-check for diastasis recti video as well as on YouTube. So I would encourage you to check that out, measure and see if you have diastasis recti, especially if you have some of these risk factors we will go over in a moment. And diastasis recti is really a pressure issue within the abdominal cavity. So it's something, if you have, you definitely want to address, because you have compromised stability and strength in your core if you have it. What would cause diastasis recti? Obesity and excessive weight are a common cause. Also, excessive vigorous exercise such as sit-ups, weightlifting, and heavy weightlifting, as we talked about earlier with pelvic floor dysfunction, especially powerlifting. Many powerlifters get bladder leakage, but also they get diastasis recti. Their abdominals cannot withstand that amount of pressure, and then it just is now an intra-abdominal pressure problem, and no amount of weightlifting is going to fix that. You would need to be doing a program to help restore your body and help close that gap. Steroid use can also weaken that connective tissue, that linea alba, which can lead to diastasis recti, as well as abdominal surgeries that inject air into the belly. So if you think of the number one risk factor is pregnancy, So abdominal surgeries that put air into the belly are going to do that same thing that pregnancy does and really just expand that stomach so much. Now we have an overstretched linea alba from all of that excessive air. But constipation and chronic straining when you have bowel movements can also cause diastasis recti. And then it's important to remember that the more unhealthy or rigid someone's fascia is can also put someone more at risk. Symptoms of diastasis recti. It's important to understand that many people are unaware that they have it. So they might be noticing symptoms or they might not, but I have had so many people, both male and female, who have diastasis recti and were shocked. So if you feel at all like you might have it, I highly recommend checking. So first and foremost, a bulging or protrusion in the midsection. You might find that your abdominals have a coning when you do a sit-up. That would be, it looks kind of like a cone, that it's not able to withstand the pressure and keep the abdominals drawn in, or a pooch that just won't go away, or that you're doing traditional exercises such as the V-ups, crunches, sit-ups, front planks, and it's actually making that pooch or the distension in the abdominals worse, not better. You might be having lower back pain, bladder leakage, constipation and digestive issues, SI joint instability, pelvic floor dysfunction, or feel like you have a weak core and that you don't have a lot of stability in your abdominals, or you're doing abdominal training but you just feel weak and you can't figure out why. When you have diastasis recti, I recommend avoiding these exercises: crunches and sit-ups, leg lifts and V-ups, and front planks. Some people might tell you they can be safe if done correctly, but having over 20 years in the fitness industry, I can tell you when people work out on their own, oftentimes they're doing exercises incorrectly. I like to err on the side of safety. Instead of doing these exercises, I highly recommend you do a program such as iCOREmethod, something that is designed to help close and fix that gap and the distension and overstretched linea alba. If you have diastasis recti, it's something you definitely want to fix. It's a pressure problem, which means your strength and stability are greatly compromised and you're at increased risk of several different injuries. So, of course, avoid those exercises that we just talked about that can make diastasis recti worse. When it comes to helping to fix diastasis recti, consistency is very important. I recommend our programming within the app, the Restore programs, 3 to 5 days a week. If you're doing once a week, you're not going to see a lot of results. You also don't want to be doing more. This is one of those cases, same with pelvic floor dysfunction, more is not necessarily better and can set you back. So 3 to 5 days a week is ideal. Now, some people with more severe diastasis recti, 4 to 5 finger gaps, are going to need surgery. I have worked with people who have actually fixed the diastasis recti with a gap that large, but many people with a gap that large will need surgery. Even if you need surgery, I always recommend doing a restorative program first anyway. You will go into surgery so much stronger and it will help you with your recovery as well. But it also gives your body an opportunity to heal because, again, I have had people who were told they absolutely need surgery and they actually ended up not needing surgery. So I always believe in a holistic approach first and then move to the next step if it's not working for you. I get asked a lot how old you should be when you train your pelvic floor. And pelvic floor training is really for people of all ages. Men of all ages can do pelvic floor training. It impacts our life in so many different life stages, and it impacts our posture, our movement, our sports performance. So if you have pelvic floor dysfunction or the diastasis recti, I highly recommend starting with our Restore programming in our app to help fix it. But it's also important to train the pelvic floor throughout your life. It can help prevent issues from happening in the first place. To me and so many people I know, pelvic floor training has become just part of our regular routine. You can transform your pelvic floor and so much about your body. Our body is so incredible and powerful when we give it the right tools. And the iCOREmethod app has so many powerful tools and videos that are going to help you Take control of your pelvic floor health and your body with minimal time but maximum impact. You can find us at iCOREmethod.com, in the App Store, and our socials under iCOREmethod. Reach out anytime. We are here to help you with your health and wellness in your pelvic floor and entire body.